Welcome to a short video about Pediatric Nutrition Focused Physical Exam Worksheets, Tools to Enhance Practice. My name is Michele Spurlock. I am a pediatric ICU dietitian at Children's Hospital of the King's Daughters in Norfolk, Virginia. The learning objectives are, upon completion of this educational activity, the learner will be able to 1. Use the muscle fat and micronutrient nutrition-focused physical exam worksheets for pediatric patients to determine muscle wasting, fat depletion, or micronutrient deficiencies. 2. Use the individual micronutrient worksheets to differentiate between nutrient deficiencies or toxicities. The benefits of use are organized, clear approach, easy documentation, evidence-based, consistency, and easily track findings, especially if you need to document at a later time. In pediatrics, we cannot say this enough. Children are not little adults. Here is an example of a pediatric NFPE toolkit. Here's a pen light, a head circumference measuring tape, and NFPE pocket guides from both ASPEN and A&D. Starting with muscle and fat loss, the way I use this worksheet is if no deficits, I'll put a check here or simply draw a line through it. If I see a deficit, I will circle in the corresponding box, or if the parents list anything or of concern or the teenager, then I'll simply document here. While muscle and fat loss in pediatrics are not currently part of the malnutrition diagnosis, it can be used to support your diagnosis. Note any fluid accumulations here and list locations over here. I assess functional status with hand grip strength or finger grip if an infant or toddler. I note weak or strong, or if it's a repeat exam, if it's changed and how. I also document any measurements I take, MUAC, arm span, or head circumference sometimes. Now we will go to the micronutrient by system. Here's skin, and you'll note any deficits here. Here I'll either check or draw a line through it as before. Note any possible non-nutrient causes on the right side of the page. For example, note mouth lesions could possibly be zinc deficiency, except for this patient is undergoing cancer treatment. This is also a good place to document anything of concern from the parents or the teenager. Finally, micronutrient by the elements. Use individual worksheets if need to differentiate between nutrients or doing a focused exam. Listed here are both signs and symptoms of deficiency and toxicity. This can build a strong diagnosis of either deficiency or toxicity. To summarize the pediatric NFPE worksheets. Adding the pediatric NFPE worksheets to your personal toolkit allows you to feel confident in creating a good malnutrition, deficiency, or toxicity diagnosis. And here are the references. I would also like to take the opportunity to thank ASPEN for allowing me to share my NFPE worksheets.